Welcome to Stand Up for Doctors. I'm your host, Kim Downey. Thank you very much for joining us. I couldn't be happier to have Dr. Robert Kornfeld as my guest today. Welcome, Bob.
Thank you, Kim. It's great to be here.
I'm glad to have you. Bob and I connected on LinkedIn about 6 months ago. Shortly thereafter, I wrote an article for Kevin MD titled "The Struggle is Real for Patients and Doctors." I shared a quote in the article from Bob about how much gratitude from patients is appreciated by doctors. I followed Bob's post and we continued communicating. I found out Bob was in a band and I asked him if I could use a few bars of his music for my podcast intro. He graciously and enthusiastically said yes. I really love it that my opening music is by a musician who is also a physician, whom I have come to know and respect. Bob and I also collaborated on another Kevin MD article, Doctors Rediscover Joy in Practicing Medicine on Their Own Terms, along with Drs. Amna Shabir and Dr. Tamara Beckford. Our podcast about that article should be going live anytime now. Today we'll be touching on 3 topics. First, Bob's work as a functional medicine podiatrist for chronic foot and ankle pain. He'll be answering the question, what is functional medicine really? And secondly, Bob practices using a direct care model where patients pay him directly, eliminating insurance in the middleman. I'll ask Bob to answer, what physician specialties do you see using the direct care model? And who would you see transitioning to this model being more difficult for? And thirdly, I'll also ask Bob to tell us a little about his band and the role that music plays in his life. Bob has a great deal of life wisdom that he offers through his LinkedIn posts and comments. One thing he shared that has really stuck with me is if you're stuck, it's because you're pouring the glue on your own feet. And I love that that came from a podiatrist. It's perfect. So thanks again for joining me today, Bob. What would you most like our audience to know about you as we begin our conversation?
Well, I think our conversation will probably reveal the fact that I'm an outside-the-box thinker. I've never allowed boundaries to hold me back from following my calling. And when I first went into practice, I obviously was working inside the box that was prescribed to me, and it was very difficult for me to stay there. So I guess my message to everybody is, when you live inside a box, you have to remember knowledge and the universe keeps expanding, which makes your box smaller and smaller and smaller. And that is not a healthy place to be stuck.
That is a really good way to start, and that makes a lot of sense. I love the way you said that. Thank you. So as we're heading into our first topic, I'd like you to tell us a little about functional medicine in a way that makes sense to anyone not familiar with it, and perhaps share some specifics. For instance, we've all done patient evaluations. I'm a physical therapist, so if I was going to look at somebody's foot and ankle, you do strength, range of motion, sensation, gait analysis, all those kind of things. And I'm curious as to what separates a functional medicine eval from a traditional one. Specifically, how does it differ? Because sometimes conversations about functional medicine can turn a little abstract or esoteric. So I'd like to really get to the meat of it.
Okay, I'll do my best. So functional medicine is kind of an adjunct to traditional medicine. In the traditional medicine realm, we're taught to figure things out to make the diagnosis, and then we treat the symptoms that the patient presents with. And that's fine and good for a percentage of the population. Unfortunately, it doesn't work for everybody, and we have an increasing number of patients who are living with chronic conditions. What functional medicine does, once a diagnosis is made, it asks a really important question. Why this patient at this time? So when a patient becomes symptomatic, we call that the morbidity threshold. It's at that point that their immune system is not repairing injured cells properly, or not replacing dead cells. It's not replenishing used up things. It becomes inefficient. Functional medicine looks for these underlying mechanisms that have burdened the immune system, made it inefficient, and allowed the patient to cross that morbidity threshold into the world of symptoms and suffering. In my practice, which of course is a podiatry practice, most of my patients come in with chronic foot and ankle pain. 99% of them have been failed by the traditional medical approach, where the diagnosis was made and the symptoms are attempted to be treated. But in traditional medicine, we take kind of a opposite approach than what we learn in functional medicine. If a patient comes with pain, we try to suppress it. If they come with inflammation, we try to suppress it. In the real world, there are pathways of inflammation that are directed by the immune system on purpose. The body uses it to either heal things, and when healing's inefficient, it uses it to protect what's not healing. So when we suppress it, we actually get in the way of healing. So in a functional medicine practice, we look for the reasons why the patient's not healing. We address those underlying mechanisms, and then instead of suppressing, we support the body to heal itself. So it's actually health promoting rather than symptom relieving.
So kind of like a fever, right? You can treat a fever, but if you don't figure out why the person has a fever in the first place.
Precisely, exactly. I'll dilute it down to something very simple that people will really understand. I once had a patient who was referred to me with a history of 17 years of chronic ankle pain. All blood tests were normal, so we knew it wasn't an autoimmune illness. All x-rays were normal, so we knew it wasn't an arthritic degeneration. All MRIs were normal, so there was no cartilage damage, torn ligaments, torn tendons. No one can figure out why this poor guy was suffering. Yet he had been through 17 years of medication, injections, physical therapy, braces, orthotics, you name it. The way I start is by looking at the things that we have control over. So any of these patients who come to me, I ask them to journal their diet. And when he handed me the diet, there was nothing in there about water. And I said to him, I need to know all of your liquids, and you didn't put it in. He goes, yes, I did. I have 3 cups of coffee in the morning. I have 2 cups of coffee at lunch, and I have 2 to 3 glasses of wine at night. Now, all of those are dehydrating. So I said to him, I can't even begin to treat you until you're properly hydrated. So I taught him how to hydrate himself over the course of time so he wouldn't spend his days in the bathroom. And when he came back, which was probably 2 to 3 months later, he was up to 8 to 10 glasses of water daily. Then I said to him, okay, I'm really glad to hear that. Now we can begin to treat you. He said, why? I have no more pain.
Wow.
So you see, 17 years, I'm the first one that looked at his diet and how he's feeding himself.
Wow, and just that changed. So when it wasn't permanent damage after 17 years of pain, that the body was able to heal itself.
Correct. That's the simplest form of functional medicine analysis. We look at diet, lifestyle, environmental influences. We look at DNA mutations. There's all these things that affect the way the body works. So rather than jump in and treat an arthritic ankle, I want to know why it's arthritic. You know, in medicine, they say, well, there's a gene for arthritis. Well, that's true. But how come the gene didn't express itself till the patient was 56 years old? What was going on for the first 56 years? So you see, we really have to understand why these things happen. And functional medicine gives us those answers. And it up-levels the health of the patient, which is really why we should all be doing functional medicine, because medications don't up-level the health of the patient. They add toxicity, they cause side effects, and they give the patient a false sense of reality, because while they're on medicines, they don't know if they're re-injuring or further injuring something that's already struggling to heal. So I call it bass-ackwards medicine.
Right. So I know when you had first started your functional medicine practice that you had some patients coming for traditional medicine and some were coming for functional medicine.
Right.
Now you're fully a functional medicine practitioner. So does that evaluation look different? Like, do you still take the time to do like the strength, range of motion, gait analysis, or have those things already been done so many times before? And is this just looking at functional medicine type things?
Well, because I have the time to invest in my patient care, I have the time to do a complete biomechanical analysis. These patients are coming from offices where doctors accept insurance. they're seeing 50 patients a day. There's no way they can be a comprehensive evaluation. So I find oftentimes things were overlooked, things weren't addressed from a biomechanical standpoint. And then I have the time to interview them, review their medical history, review their family history, go through the review of systems where we ask them questions about every part of their body. And I can determine from that information where I think the burdens lie and what lab tests I need to do. And there are many different lab tests we can do, but I don't throw them all at the patient. I try to pick the ones that are pertinent to what the patient is presenting with. And that's one of the things you learn in functional medicine, is how to decide what kind of tests will reveal the answers you're looking for. Because you don't want to throw $3,000 worth of tests at every single person that walks through the door. It's not fair, and it's not prudent medicine. So I have the time, and when a patient comes to me as a new patient, we're face-to-face for 60 to 90 minutes. When I used to take insurance, it was 8 minutes, maybe if I was lucky, 10 minutes. If it went beyond 10 minutes, I had staff sticking their head in the door, yelling at me that I was falling behind because there was a million people in the waiting room. So it's a very different approach when you're in a direct care practice, because you don't need to see that many patients because you're not working for $8.22 a visit. And you don't have your accounts receivable building up on you over the course of a year. You have the ability to provide optimal service at any given day. And I'm in love with this way of practicing. I've been doing it strictly for 23 years. Before that, I did insurance, and I did accept insurance, and I did a lot of foot and ankle surgery. And I kept doing the surgery up until about 12 years ago, but I'm not doing it anymore. Because to me, the answers lie in addressing what's going on in our patients' unique physiology, diet, lifestyle, and environment, and their genetics. And that's where we should all be looking for the answers to solve patients who are struggling to feel good, struggling to get well.
Right. Well, thank you. So one more question before we move on is
Sure.
as far as specialties that this would dovetail nicely with, like I would think right away, like rheumatology. And now what about specialty? Because I know anyone can go on to continue their training, and it would enhance any specialty. But are there any ones in particular that you would think, dovetail nicely with this?
I think anybody that's treating chronic conditions,
Okay.
it would work well with. And people used to say to me, well, I don't really evaluate people medically. I just do surgery. Well, here's an amazing thing that I found. Once I started doing a functional medicine workup to prepare my patients to heal optimally from the surgery, many of them got better before we went to the operating room. And those that still went to the operating room had far better outcome, much lower complications, much lower infections, quicker healing, everything worked better. I would imagine that cancer doctors should be using this approach in addition to everything else that they're doing. And it's not an either or. Traditional and functional medicine work well together. I don't do a lot of traditional medicine anymore because I haven't found it necessary for my patient population. But I think combining the two is fine. It's just understand your patient. Everybody has unique situations. I can get 10 patients with the same exact diagnosis, but the underlying causes and mechanisms are different.
Right.
So we're all unique.
Right.
And that's how we should approach it. We call it patient-specific medicine.
Okay, exactly. Well, thank you very much. So my second question is, we mentioned that you went to a direct care model, and this intrigues me, and I believed we discussed it a bit in a comment thread once. And there may be doctors listening who are also intrigued by the idea, though they might have many doubts about the logistics of getting started and the sustainability of the practice. And of course, there's also concerns on the patient side regarding cost. And for example, at this time, so I haven't mentioned on my podcast, I have to do some kind of introductory episode, but I've had cancer 3 times recently over a 2-year period. And right now I see an endocrinologist, radiation oncologist, and gynecologist once a year, a primary care doctor and surgical oncologist twice a year, and a nephrologist and medical oncologist 4 times a year. And then there's annual scans, including mammograms, 2 different kind of ultrasounds, and an MRI. This is every year. And I'm on some medications that I have to be on to keep me alive. So
Right.
my questions for you are all of those doctors candidates for a direct care model, in your opinion? And what about from the perspective of the patient with complex medical needs? Because you can't have a doctor without patients, and you can't have patients without a doctor. If you're a patient without a doctor, you're just sick.
Right. Exactly. Well, here's the thing. I could still be doing traditional and functional medicine. I just basically chose not to. In the world of direct care, just as in the world of traditional care, there are patients that are not going to fit the model. So we need insurance. We need something called catastrophic insurance more than we need the typical healthcare insurance, because they get in the way of a lot of the things that doctors want to do. They have silly prior authorizations, and they delay claims, and they put things off, and they won't pay for the medication that the doctor wants to prescribe. They only let you have a different medication. So there are snafus. There's high deductibles, there's copays, there's non-covered services, let alone the premiums. In most cases, and I'm not going to say every case, in most cases, if you look at the healthcare expenditures and do the metrics, the greater majority of people would do much better paying their doctors, purchasing a catastrophic plan for major medical issues, and paying the doctors as they go. And they would save thousands and thousands of dollars every year. That's already been, posted on LinkedIn a number of times by different statisticians. Now, that's not to say that the direct care model will work for everyone, nor at this point does traditional model work for everyone. Most of my patients come to me, and after that initial visit, they'll say, "Oh my God, I never had anybody ask me these questions. I never had anybody examine me this way. I never had anybody explain anything to me. I never had anyone that said, not only am I going to get you well, but I'm going to make you healthier." These are things they can't experience in the traditional insurance dependent model because the doctors don't have the time. So things get missed. Doctors assume things. They say the average doctor has his, diagnosis in his head within 15, 20 seconds. So it doesn't really matter what the patient says. He's not listening. In functional medicine, we listen because there's a lot of information we need to compile all of the data we need to create the proper journey for this patient so we can get them well. So I know I'm not answering your question directly, but I would say everybody has to figure it out for themselves. But while insurance companies are continuing to exploit and abuse doctors, the system's not going to work well. And it already doesn't. Too many doctors are suffering from burnout. We lost, the last year that they did the numbers, out of 1 million physicians, we lost 117,000 who quit medicine in the year 2020 to 2021. That's more than 10% of all the doctors in America. Serious problem. And we're losing doctors daily, in addition to the fact that physician suicide is up to crazy numbers. So we're doing a lot of things wrong. And by letting insurance companies and private equity run medicine for profit, we've lost the forest for the trees. And I'm very disappointed, but I am here to say direct care is an amazing model to help people and get them well. And right now, it's just a matter of reconditioning the public to understand why it's a better model, and reconditioning doctors who usually will say to me, "My patients will never pay me." Well, why would they if they're conditioned to walking in with an insurance card and giving you a $50 copay? They don't understand that there's other options until they're presented. The patients that doctors struggle with, they can't get them well. Those patients quit and go to other doctors. A lot of my patients have been to 10, 15, 20 doctors, and they're still not well. So the system is inefficient at best. It works for a great many people, but it doesn't work for a great many people because we don't realize that a lot of the medical therapies that we use give rise to other medical conditions because the underlying mechanisms remain unaddressed. And that's not a good thing. And after 36 years doing functional medicine, I want to stand at the top of the Empire State Building and shout at everybody, what are you doing?
Right, right. So you were fortunate to start this earlier in your career. What do you think if people are like mid-career physicians or a little bit later career, or the
It's never too
obstacles to
late.
transitioning insurmountable, or it's never too late?
No, nothing is insurmountable. You know, when people look for the easy way out, they stay stuck and miserable. It's not an easy transition. It's hard. It takes work. It takes a couple of years to get things really running the way you want them to. But it's well worth it because doctors themselves are running into much higher levels of morbidity because of all the stress they're under. So if a doctor's not feeling well, if a doctor's under stress, he's not going to be the best doctor.
Right,
He's consumed with his own stuff.
right,
So let's save the doctors first so the doctors can save the patients.
right.
And in order to save the doctors, we've got to get them out of the model that's killing them.
Mm-hmm.
It is killing them.
Yeah, no, I understand that. So, well, thank you. That was very enlightening. And so let's save a couple minutes here to so I know you are to be a man of many talents and well versed in many languages, including the language of medicine and foreign languages. Do you know at least a couple foreign languages?
I don't speak anything fluently, but you know, I can speak a few things.
Yeah, okay. Well, that's impressive.
But my favorite language is music.
And that's what I said, and the language of music. So that was
Right.
the segue here. So
Right.
I know that playing music brings you joy. So I'd like you to tell us a little about your band and the role music plays in your life, because we all need hobbies, right? Everybody needs to have a little joy, a little fun,
Right.
a little play in their life.
Well, I actually started college as a music and theater major. And at the end of my first year of college, I was a little frustrated and I was already in a band that I thought was amazing. So I made the decision to drop out of college and become a famous rock star. And needless to say, that didn't work.
Thank goodness, right? For all the people that you
Right.
were able to help.
So I thought if that doesn't work, I better go back to school and do something that can actually sustain me and provide for my family. And while I was in college, I took up running and I developed a really bad plantar fasciitis in my right foot. I went to a podiatrist and he was just a pleasant guy. He was happy. He was always smiling. He always was in a great mood. And one day I said to him, "Why are you so happy all the time?" He said, "Because my patients come in pain. I usually send them home feeling better. They thank me and none of them die."
Yeah.
So I kind of got attracted to that. And that's kind of what, pushed me this way.
Oh,
Yeah.
I was going to ask you, what pushed you towards podiatry? So that's
Yeah, that's what it was.
interesting to know. And
Yeah.
then so your band. So did you keep music in your life all along? Or?
So I actually put down my drumsticks to, go through school and postgraduate training. And the early years of my practice, I was inundated with patients. And I wound up going through a very severe period of burnout, anxiety, depression. I thought I had a million different diseases until I finally realized what was going on. I was working against my own innate core, and I was trying to make something happen that didn't resonate with who I was. And when I finally figured that out and started making the switch and started going for training in more of a holistic model of medicine, that's when things turned around for me. But I did eventually go back to music, but I couldn't play my drums. I didn't have time to be in a band. I taught myself how to play guitar and I started writing my own songs. And I did that for years. And then I started getting them professionally produced.
Wow.
And then at a certain point in time, probably, I'll say maybe 10 years ago, 11 years ago, I decided I wanted to start playing in bands again. So I couldn't find anybody that wanted to do the blues, which was my number one favorite music, because it's so deeply emotional and you get to express everything that's going on deep inside. So I was playing in rock bands and rock bands and rock bands. And finally I said, you know what? I'm done. I advertised to start my own blues band and I run it and I do, all of the legwork to get the band its gigs, and I organize everything for the band, and it's just been the most pleasurable experience of my life. I'm with some unbelievable musicians, and we're all on the same page. And we really, when we go out and play live, everybody has a great time. And it's not the typical blues that people think, oh, it's so sad and depressing. No, we don't play that kind of blues. We play blues that make you tap your feet. We play blues that make you stand up and dance. If you listen closely to the lyrics, it's deeply emotional, but it's not the kind of stuff that'll put you to sleep.
Yeah, well, I love it. I think the intro to my podcast is perfect. I'm going to try to add a few bars at the end too. And I think that's a perfect example. And we don't live all that far from each other. So you should send me a list of when and where you're playing. And someday I could probably come hear you play.
All right, that would be great. I'd be happy to do that.
I would love that.
Sure.
Okay. Could you please share any top tips you have for your colleagues, from seasoned physicians to medical students, or even those considering med school? You have any top tips?
Yes, I guess my top tip would be that if you really want to have a successful and happy professional experience, you have to have your authentic self in the practice. If you're practicing outside of your own belief system, if you're trying to make something happen that goes against your grain, you're going to suffer, you're going to be miserable. So I would say, follow what's going on deep inside, know who you are, put a vision together of what you see yourself doing in your practice, and then make it happen. Don't listen to the people training you. A lot of them are miserable. A lot of them are unhappy. A lot of them are frustrated. Do not listen to the people that have nothing good to say about medicine. Medicine is an amazing thing to do. It's gratifying and it's incredible. The system is what stinks. So choose your system wisely so that you don't suffer like a lot of these people who do suffer, you know.
Right. Very well said. Was there anything else that you wanted to share with the audience?
Well, just that, you know, for the podiatrists out there, I have a teaching institute, and I'm teaching the functional medicine part of the paradigm of medicine in functional medicine. And I also teach them how to create a successful direct care, or what I call direct pay practice, so that they can get away from the rigors of insurance dependency, stop dealing with the stresses, stop feeling overwhelmed, and start really enjoying practice. Because the beautiful part of it is your doctor-patient relationships become deeper and more potent, and that's where healing is. If you can create bonds with your patients, they're compliant. They believe in you, they listen to you, they do what you recommend, and guess what? They get better, and it's amazing.
Absolutely.
So anybody who wants to learn more should get in touch with me.
Okay, so that's a great segue to how can listeners get in touch with you?
Well, they can either email me at drrobertkornfeld@gmail, which is Dr. Robert and Kornfeld, Kornfeld @gmail. They're more than welcome to call me directly at 516-369-3172.
Okay, thank you very much. And I'll put that in the show notes there.
Okay.
And you can find me on LinkedIn.
I know.
So, all right. So thanks again for being my guest today, Bob.
Oh, it was a pleasure. Thank you, Kim, for having me.
And in closing, to move the needle in healthcare, we all need to raise our voices, and we all need to care about each other. We already know that doctors need to care about patients. Patients need to care about doctors too. So stand up, doctors, and let's stand up for doctors.
Yay.